Hey everyone, Dr. Melinda Austin here. I gave this presentation in my fourth year of vet school for grand rounds, but I just wanted to go over some additional information with you here. Everybody can do it, wildlife triage and general practice. This is mostly geared towards veterinarians, but if you are a technician, a rehabber, or someone interested in science or behind the scenes wildlife rehab, this talk is for you. Let's get started. Wildlife, who cares, right? There's plenty of bunnies and rabbits out there, and it's a pro bono case. We don't charge for wildlife services. Your clients care. As veterinarians, we're going to get calls about my dog got into the bunny nest, or there's a baby bird on the sidewalk. What do I do? Because we're expected to be experts in all animal things. Not only does it show that you're knowledgeable and passionate about the community, it will help strengthen relationships with your existing clients, as well as it may generate business with future clients. Also, your staff cares. This is something they don't get to do day in and day out, and it's a feel-good story. Lastly, I would say it's the right thing to do, and you can reference our veterinary oath here with some highlighted portions that I think are relevant to wildlife. Is it legal? A lot of veterinary clinics will get calls from presenters who are Good Samaritans who have found wildlife, and the vet clinic says, we don't have a wildlife license. So maybe they don't know the laws, maybe they're not aware that they are able to do this, or maybe they don't want to risk zoonotic diseases for their companion animal patients. In summary, yes, as a DVM, you can practice wildlife medicine for up to about 48 hours. So a DVM can prescribe and diagnose and perform surgery, whereas a wildlife rehabilitator is licensed to possess wildlife for longer periods of time until they release into the wild. They can perform bandage changes, they can administer medications, and they can perform euthanasias. So as you can see, both roles are very different, but both are necessary for the success of the animal. Certainly contact your DNR with any questions that may come up. And for reference, here's the Iowa Code of Law stating that you can in fact practice wildlife medicine with just your DVM. Some species considerations should be kept in mind. For example, birds migrate between states, so their jurisdiction does not fall in one state. It is actually a federal regulation. Bald eagles, you always need permission from your DNR to euthanize. And when you are finished, you must send the carcass and all feathers to the National Eagle Repository in Colorado. So certainly, if you're ever unsure of what you can and cannot do, reach out to myself, another rehab facility, or your DNR. When do we euthanize at intake? This is an uncomfortable conversation, but it needs to be had. My name is Ahimsa Wildlife, meaning peaceful or non-suffering. And so my main goal is no animal should have to suffer. With that being said, there are some legalities. Some species should not be released if they only have one eye, because if they cannot see, they cannot survive. There are other regulations, such as you cannot amputate a bird wing proximal to the elbow joint. Other issues may include severe injuries, such as an old open fracture or joint compromisation. And so if you have any orthopedic issue and there's a malalignment after being fixed during surgery and things like that, you can get secondary osteoarthritis. Now, we don't want to release this animal into the wild because then we're making them have a lifelong pain and arthritis, which is not fair to them. Definitely keep those things in mind. Pinkies are pictured here, furless neonates. And there's been a lot of research done both in large rehabilitation settings as well as anecdotally with rehabbers that certain species-specific weights correlate with success rates. So almost none of these little guys survive. They don't have an immune system. They often get aspiration pneumonia, iatrogenically, and other things like that. Baby opossums are attached to mothers, as you may know with marsupial anatomy. The nipple acts as an umbilical cord fashion. So if that becomes broken, the immune system is not fully developed, as well as their esophagus is just so tiny, we cannot get a tube down there without lacerating it into the stomach. So please do reach out with questions about this. Incurable diseases should also be euthanized. This is going to be rabies and distemper virus. So if you have a rabies vectors with neurologic signs, foxes, skunks, groundhogs, bats, raccoons, it is recommended to euthanize and send for testing. If you have a raccoon out in the day circling in someone's yard, it's lethargic, it has ocular or nasal discharge, this is distemper virus until proven otherwise, and this is 100% fatal. How do we euthanize? Rehabbers and veterinarians follow AVMA guidelines, and so you can feel free to check those out. At home, we might use manual blunt force trauma, carbon dioxide, or inhalant gases can be used in the clinic. For reptiles, check out Mater's book here. There are different approaches, but reptiles really don't like to die. So here's one protocol used out of the Wildlife Rehabilitation Center of Minnesota in cases that cannot be saved. And they wait 15 minutes in between. You must do this on a heating pad to metabolize your drugs. And Mater's also mentions this more applies to pets who you're sending the carcass home with an owner, but make sure they're dead. So you need to draw a circle around them, wait 24 hours, and make sure they have not moved. I've ranked the 5 freedoms here for stabilizing wildlife in a triage setting in general practice. So this list would be very differently for rehabilitators. You see, lastly, I have listed freedom to express normal behavior, which is super important. But in terms of just stabilizing an animal in your clinic for 48 hours before getting it to a rehabber, what I want you to focus on is reducing stress, making them comfortable, then work on thirst. We should not have to work on nutrition, but we'll talk about that in a minute. And then you can feel free to add pain meds on board, but it may be difficult to assess. Happy, hot, and hydrated. These are the things to focus on. To be happy, what I mean is to decrease stress. And the best way to do this is to decrease visualization. So you can use commercial products like this hood shown here, or just a towel will work. Cover up a kennel with a blanket, things like that. Hot, use an incubator to keep any babies warm, especially neonates. Cool, dark places. Lastly, hydration. Just like with our companion animal patients, fluids do wonders. Just for your reference, here's a little bit of a fluid chart on where to start. And why do we hydrate but not feed? I would say a very common question from presenters is, what can I feed this animal before I get it to you? And the answer is nothing. Whether we feed the wrong thing or sometimes they can aspirate, refeeding syndrome is a big deal. If an animal has not eaten, it's been grounded on the side of the road for a few days, the presenter rescues it and feeds a meal while it's dehydrated, they can have an increase of insulin secretion, an electrolyte imbalance, and go into cardiac arrest and die. So what I tell people is waiting a couple more days without food's not going to kill them, but if we feed them while they're dehydrated, it actually can kill them. In terms of hunger, fluids first, think about what they eat in nature. Unfortunately, I get many questions about hot dogs. Those do not grow on trees, so please do not feed them hot dogs. We can use leafy greens. You can use fruits for some animals. You can use veggies for some animals. And in some cases, we can use kibble for cats or dogs. Amounts that need to be fed are available. Feel free to reach out for those. And consider, how do they eat it? Do they dig in the ground? Do they eat from trees? Things like that. Pain is very difficult to assess in wild patients. They are prey animals, so they survive by not showing pain. They hide, they freeze, they flee. They typically do not have to sit there and demonstrate a menace or a deep pain response for us. So do not rely on those. It's okay to go ahead and throw pain meds on board preemptively. These are some great resource books for you. There are common treatment protocols available. Which drugs do we use? Which ones work? What are the doses? How often? How long? And common presentations. So what do I do if I have a baby bunny that a cat caught and punctured with its teeth? Reducing stress is super important and is going to help us expedite healing. So something I want to touch on is capture myopathy. And probably fortunately for all of us, I'm not going to go into the Krebs cycle here. But what happens is they use up all their ATP, they become hypoglycemic, tissues are anoxic, lactic acid increases, calcium becomes imbalanced, and muscles become stuck in the flee response. This can cause brain damage, death, and immediate rigor mortis. This can happen hyperacutely. So this can happen within minutes to seconds of seeing you or being handled. This can happen in hours, days, weeks, and even months after being released back into the wild if they have a myopathy damage. So watch out for that. Some signs to look out for are obviously going to be stress, open mouth breathing, agitation, things like that. So you really have to handle these guys one and done. Have a handler who's comfortable and knows what they're doing. Keep those eyes covered, and you can monitor renal values. Freedom to express normal behavior. If you have the resources in your clinic, certainly this will help keep them low stress. So you'll see here on the left, varying ages of screech owls with different perching options, different materials versus different heights as well. In the center, we have a bat being allowed to express its natural behavior by hanging. And on the right, we have some baby birds in boxes or little nests made out of paper towels. Baby mammals should be offered a stuffed animal to climb on that is similar to a mother. So this would be possums or squirrels. In summary, consider your legalities always. Every state may have different regulations, but know that your DVM does allow you to practice wildlife medicine for about 48 hours before transferring to a rehabilitator. In short term, the goal is to keep that animal alive and to not suffer so that they can heal faster. And in long term, heal quickly and effectively and be released back into the wild. Here's some additional resources. Here are some references for this PowerPoint. Should you have any questions, always feel free to reach out to me. And with that, thank you for stopping by.